up with the idea in terms of negotiating, hey, I'll pick up your health coverage. Well, what that did was it sort of broke the relationship, the insurance relationship between the insured and the insurance carrier. We don't have this sort of irrational pricing in other aspects of insurance. We don't have this problem in automobile insurance by and large, or casualty insurance, or homeowners coverage, or even life insurance. But for some reason, health insurance has become irrational. The other component that has to be a part of this deal, it seems to me, is that physicians have to be protected from lawsuits that tend to just drive up medical costs and practicing defensive medicine. And the president, with all due respect to him, when he came before the American Medical Association and gave his speech to the House of Delegates, he just struck me as pretty dismissive of physicians' complaints and concerns about the exposure that they have. And he kind of chatted them up a little bit, but he ultimately didn't offer them anything. And I think that's one of the reasons that that I'm hearing from physicians in my district, that they are very reluctant about following along this path.
Congressman Peter Roskam is serving his second term in the House of Representatives, and he has also served in the Illinois State House and Senate. And I wanted to ask you about how to pay for health care in whatever form that change may take. This USA Today article from today talks about when it comes to financing the costs, 6 of 10 favor the idea of requiring employers to provide health insurance for their workers or pay a fee instead. Increasing income taxes on upper-income Americans, an approach backed by House Ways and Means Chairman Charles Rangel of New York, is endorsed by 58%. Just over half support taxing sugary soft drinks.
Well, nobody sent me to Washington to raise their taxes, and I think the folks that I represent in the 6th Congressional District of Illinois are feeling a very, very heavy tax burden. Now, we're having this conversation in the context of one of the worst recessions that our country has experienced in decades, and we're also having it in the context of an administration that promised sunshine and roses, basically, that our unemployment was going to peak at 8% if only the stimulus plan was going to be passed. And now we've got a serious proposal that would increase the tax burden on American citizens. Even Chairman Rangel's number, if you look at Dr. Christina Romer's analysis of that type of tax back before she was President Obama's chairman of his economic advisors, and I'm paraphrasing this, but the Wall Street Journal does a good job today, characterizes that as anti-stimulative. In other words, that tax burden that Chairman Rangel is talking about is going to have a disproportionate impact on small businesses, and it is small business that creates jobs and creates opportunity in this country by a wide margin.
So how to pay for it? What is the solution?
Look, I mean, I think one of the things that I'm most interested in is what is it that the Democrats want to do? They're now arguing in the alternative. So they've got a proposal that's out there, and the original scoring that we heard about took everyone's breath away, $1.5 to $1.6 trillion. And I think that is one of the areas that suggests you cannot create this new middle class entitlement, because if you do, it will be a crushing burden on the American public.
Our next caller is on the Democrats line. Robert is calling in from Oxford, Pennsylvania. Hi, Robert,
morning.
You're on the air. Good morning.
Good morning, and thank you for C-SPAN. We watch it every morning. I don't know exactly how to put this, but we are really, I mean, you talk about the medical problems, and it is great. We were forced into Medicare because our private insurance company, which was Personal Choice Blue Cross, their rates just went every year up and up and up, and your co-pays are up and along with it. So we were forced into Medicare, and even with that, with the supplementary you have to buy, I mean, we're paying close to $500 between my wife and I for the supplemental, which pays what Medicare don't pay. And my wife has suffered with a health problem where just 21 pills was $5,800, and it was a drug that was developed back in the 60s. Our doctor said it probably should have been like $40 because it's been on the market for so long, but because it's supposed to help this cancer, which it didn't. But anyhow, 21 pills was $5,800. Our copay was $3,800. And many times, the person goes to the hospital, they're forced out by the insurance companies because they're in there for the length of time they think they should be. Their doctor has no control over it. Many times, they're forced right back into the hospital because they had infections, because they were sent home too soon. And like for MRIs, they don't want to do that right off the bat because it's supposed to be too costly. But yet they'll force you to do X-rays, or they'll force you to do scans, and then they'll do the MRI.
Robert, let's get a response from the congressman. Thanks for your call.
Yeah, Robert, thank you. And I think you're accurately portraying a real weakness within the current system. One of the things that we've got to be able to do is lower the barriers of entry for people to be able to negotiate with insurance companies. So right now, insurance companies have a dominant place in the marketplace. And why is it that we have laws that are in place that prohibit alumni associations or chambers of commerce or other groups to be able to pool together and create their own market to go back against the insurance companies? I think you accurately state a real problem, and I think that that's one of the things that we can drive towards that doesn't jeopardize some of these other core principles that I mentioned earlier.
From Orlando, Florida, Tim joins us calling on the independent line. Hi, Tim. Tim, are you with us? I think we've lost him. We'll get him set up in just a moment. In the meantime, what do you see happening over the next month or so? Tight timelines here. Do you feel like the Republicans will be involved in the debate as the Democrats do craft some of the